Challenging Behavior and Young Children with Autism Spectrum Disorder. I'm Sharon Darling, your presenter today. I've served here on faculty at FAU since 2004. I earned my PhD at Georgia State University in early childhood special education, and severe disabilities. I currently serve as an associate professor in the Exceptional Student Education Department, where I teach in early childhood special education, and conduct research in these areas as well. I also teach special education teacher preparation and disability studies. I'm honored to be your presenter today. As a result of attending today's session, you will identify diagnostic and behavioral criteria of children with ASD. You will define behavior and challenging behavior. You will explain how behavior impacts development in young children. You will be able to define and describe challenging behaviors exhibited by these students, particularly those with ASD. You'll be able to also identify and describe how behavior might serve as a tool for communication for children. You will identify instructional and environmental supports to avoid these challenging behaviors in the classroom. And then last, I will introduce you to the idea of a multi-tiered approach for supporting behavior. Let's start with the DSM-5 diagnostic criteria for ASD. Autism spectrum disorder, shortened for ASD, is a disorder that occurs during childhood, that occurs beginning in early childhood years. The DSM is a diagnostic and statistical manual. We're on the 5th revision from 2013, where they provide 5 criterion that must be met for children to be diagnosed with ASD. Criterion A includes social emotional communication deficits across multiple contexts. This includes examples such as social reciprocity, deficits that children might have, abnormal interaction styles such as lack of eye contact or body language. Criterion B speaks to restrictive, repetitive patterns of behavior, interest, or activities. Examples of these are insistence on sameness or fixated interest in children. Criterion C, these symptoms must be present in the early developmental period. This is a little bit different than previous criteria in that this early developmental period allows for manifestation later in children such as age 5 or 6, when the demands of the learning or social environment exceeds the child's skill level. Criterion D speaks to symptoms impairing functioning in social, occupational, or other important areas of current functioning. So this is where you're going to see your social skill deficits, still children or young adults having adverse reactions to change, depending on their social or work environment. Criterion E speaks to ASD not better explained, or children cannot be diagnosed with ASD if their deficits, particularly in terms of delay or intellectual disability, can be explained by some other criteria or diagnoses such as MR or intellectual disabilities, sorry. So examples of that is not really an example. It allows for us to consider ASD if it is a comorbid a comorbid existence with delays in cognition or developmental. However, those cannot be the dominant condition. So criterion A through E must be met for a child to be diagnosed with autism. Just wanted us to build a shared understanding of the children and students that we're speaking of today. So let's start with defining behavior and challenging behaviors. But before I get to the definition, let's speak to behavior a little bit. So behavior is anything that a person does. Behavior refers to all behaviors, not just problem behaviors. Oftentimes we fall into the trap of only discussing behavior when it's a negative or behavior that we hope to extinct. But understand that the term behavior refers to all behaviors, not just problem behaviors. Behaviors must meet these 3 criteria. They can be seen or heard. People can agree that something happened, so it's independent observers will see the same thing. And then last, it can be measured. We also have to think about some universal truths about behavior. All human behavior is learned, period. All behaviors occur for a reason. No behaviors occur out of the blue. There's usually some kind of antecedent or consequent event that reinforces or does not reinforce that behavior. Behaviors persist because they're functional for us and for children too. So behaviors that no longer serve a function no longer exist. And then last, behaviors decrease or go on extinction because they are no longer functional. So if we are having children around in our environment that are exhibiting challenging behaviors, then we need to think about looking at the function of that behavior and how we can remove that function, or teach a child a replacement behavior that will serve the same function. Challenging behavior. So Kaiser in 2018 gave us this definition of challenging behavior. It interferes with children's learning, development, and success at play. This is not just for the interfering with the development or success at play for the child, but also for other children around them. Challenging behavior is harmful if it threatens the safety of the child or other children or even adults in the environment. Challenging behavior interferes with the teacher's ability to teach and children's opportunities to learn. And then last, challenging behavior puts children at risk for later social problems or for school failure. So I want you to think about how many examples of challenging behavior you might be able to generate now that you have this definition. Now we can move on to child development and the impact of behavior. Child development. Before we discuss child development, let's think about the whole child. Young children's development is typically conceptualized as development across several domains, 5 specific domains that is. These are adaptive or self-help. These are cognitive. These are communication, physical, which includes fine and gross motor, and social emotional. Adaptive self-help covers areas such as the child's ability to meet his or her own needs. So as you know, this is going to be age specific. So for a 2-year-old, is this 2-year-old able to pull his or her pants up or feed themselves independently? Cognitive talks about thinking, metacognition, and the speed and accuracy with which children process information. Communication speaks to receptive and expressive language use. Physical or motor development refers to using the small muscles or the large muscles of the body. And social emotional refers to skills that allow children or young adults anyone to engage with others and to understand the social emotional rules, understand their own feelings and others' feelings. So with that said, I want you to think about how this relates to the whole child. It refers to the whole child in that all of these systems are working simultaneously for the child to function in this society or in their context, in their environment, whether that's learning, school, home. So in attending to the needs of the child, we must attend to these various needs across all domains. A lot of times when we think about challenging behaviors, we often go straight to the social emotional domain. But challenging behaviors can impact or be caused by deficits or difficulties in any of these domains. And then last point on this slide is that I want you to understand that these domains are interrelated and cannot be considered or should not be considered in isolation as they speak to the development of the whole child. So I want you to think about the impact of challenging behavior or the potential impact on if a child is exhibiting challenging behavior and how it might impact these specific domains. I will go into each of them specifically, but I want you to take a moment to think about how challenging behavior might impact each of these domains. Let's start with adaptive self-help. So self-help adaptive domain includes everything a child needs to know to start becoming more independent. For example, feeding, bathing, dressing. For all of these domains as I discussed them, I want you to think about them in the context of repeated lack of engagement or limited opportunities for instruction in these activities, and what might be the outcome in the long run for these activities. So if over time the child's challenging behavior does not allow them to participate or to access opportunities for instruction in these domains, what might be the long-term impact of that for children? So in this domain, self-help development, we want to think about if the child has specialized aversions, obsessions, or compulsions, or rituals that does not allow them to tolerate some of these self-help activities. We know that self-help can oftentimes incorporate behaviors or activities that are very personal and involve a lot of touching, involving manipulating the body in some way, or involving the child being close to someone who's helping them with those things. So for instance, if someone is teaching a child to brush his or her teeth, or someone is trying to teach or engaging a bathing or hygiene activity, these activities might be abrasive to the child, and these specialized aversions or obsessions or compulsions that they might have might not allow them to tolerate that very well. Some children exhibit what we call self-injurious behaviors, and adults may be reluctant to allow practice with items that are involved in self-help, using a fork, using a knife, cutting, or assisting with meal prep, which are activities that we suggest all the time to engage or to promote self-help adaptive skill development. But because of children's, the challenging behavior that children might be exhibiting, such as self-injurious, we might not allow them to do that. Some children manifest challenging behaviors around food refusal, rumination, or purposeful vomiting. This too might interfere with the ability to instruct or to practice with self-help or meal prep or feeding in those types of activities that are intended to promote skill development in this area. Cognitive development, again, this focuses on how a child thinks, how a child explores, how a child figures things out. This area also includes pre-academics, but more importantly, focuses on thinking and problem-solving skills in children. And again, repeated lack of engagement or limited opportunities for instruction may impact the child in the following ways. So we know that children have difficulties with joint attention, sharing, or imaginative play. So these types of activities while they promote cognitive development, if our children inherently or definitionally have difficulty with these types of activities, you can see how over time this might have an impact on their cognitive development. If a child also has limited attention span, has tantrums, or has impaired ability to explore or figure things out, let's think about a classroom where a teacher is using constructivist methodology or problem-based learning. So a child who has limited attention span might not be able to attend to the task long enough to get something out of it. If a child is exhibiting problem behavior in the area around non-compliance or setting limits or testing limits, this might present difficulty in cognitive development, because non-compliance means that they're not following the instructions or they're not listening to the instructions in order to problem solve in a way that we as teacher facilitators would like them to do. Communication development. And again, I talked about communication development being defined as receptive, such as listening skills, and expressive skills, such as speaking skills. This area does include pre-academic reading, writing, comprehension, and understanding. And again, we also want to contextualize this around repeated lack of engagement or limited opportunities for accessing instruction. So the potential impact over time of this is that we know that if a child has what we call poorly integrated verbal or nonverbal communication skills, this might limit their effective communication over time. It impacts their ability to receive and to give communication, right? Echolalia, which you know by definition is one of the difficulties that our children exhibit with ASD, our children with ASD might exhibit, and other perseverations, this interferes with a child's ability to expressively communicate or to give room for receptive communication to occur. Children who have tantrums, disruption, or non-compliance also might have difficulties in the communication development area because it does limit their opportunities for engagement with others, whether that's their peers or their teachers, right? Physical development, motor development, how that is impacted by behavior. So this domain covers gross motor, focusing on coordination, balancing using large muscles of the body. Fine motor domain focuses on smaller muscles of the body, particularly using the hands and fingers. Repeated lack of engagement or limited opportunities for instruction might impact the child who is an eloper. Children who tend to run away, especially during outdoor playtime, if that time is specifically carved out for a child to practice or promote gross motor development, and the first thing that comes to mind when they get outside is to run away, or the teacher is spending time limiting their opportunities to run away, they might also be limiting their opportunities to engage in gross motor developmental activities. Children who have hypersensitivities, such as loud music, loud sounds, might not participate in activities that are designed to promote gross motor development skills. Those dance parties we like to throw in our classrooms, or engaging in musical chairs or other Simon Says type activities that might involve turning certain sounds on and off, certain lights on and off, that might not work so well for children who have hypersensitivities to these types of issues. And then last, children with sensory deficits who are less likely to participate or tolerate some of the fine motor activities, such as using Play-Doh or handling glue or sand and water play, drawing in shaving cream, these types of activities that we do quite often in early care and education settings, or even in schools where we are asking them to use a particular type of writing implement or writing material that might be impacted if they have refusal to engage in those types of activities due to their sensory deficits. Social emotional development can be impacted as well. Social emotional development focuses on a child's ability to understand the feelings of others, to get along with others, and to control their own feelings and behaviors. So persistent, repeated lack of engagement, or limited opportunities for instruction in these areas might impact children who have things like obsessions, compulsions, or rituals. This may decrease their ability to engage in or take the perspective of peers and adults to enter and exit play cooperatively, because these types of skills are dependent upon a child's ability to engage with others, to make their wants and needs known to others, as well as to read the room when a group doesn't want them to enter, or a group is wanting them to enter and not being able to figure that out. Children who have limited ability to initiate or respond to social interactions might not benefit from social development or social emotional skill development activities, because by definition, they have difficulty with this. Last, difficulties in sharing imaginative play or in making friends, or an absence in interest of peers might prove difficult, and over time might impair development in the social emotional development area, because social emotional development by definition requires them to look at the feelings of others and to get along with others. So that was how challenging behaviors in particular, might impact different areas of development. Now let's look at some specific challenging behaviors that might be exhibited by children with ASD. Hopefully you recognize some of them as I was giving you the examples earlier, but some common behaviors that you see exhibited by children with ASD include things like disruption, just blurting out, not necessarily tuning into the turn taking that's required in typical conversation. elopement or running away or avoidance of certain activities that they simply don't want to do. Non-compliance, that could be overt non-compliance or covert non-compliance. Children exhibit obsessions, compulsions, and rituals. So we might see some stereotypical behaviors such as the flapping and eye batting, fixated interest on specific routines. You might see detrimental aversions when those routines are violated. Self-injurious behaviors you will see quite often as well. Oftentimes we can lead that back to a communication that they're trying to convey, whether or not they're uncomfortable or overstimulated, understimulated, etc. Children with ASD, especially younger ones, often engage in tantruming behaviors. And this is beyond what is typical for their age or development. We know that tantruming and a lot of these behaviors that I'm discussing can be developmentally appropriate depending on the child's age. With ASD, you'll see this to a greater degree or more intense or more intense or more often for children with ASD. And then last, we have verbal or physical aggression exhibited by these children. You have a lot of challenging behavior. This list is not exhaustive, it's illustrative. And there are also some non-common but very evident behaviors that we might come into contact with children with ASD. Things like fecal digging or playing with their own feces, refusing food or very limited palettes or limited range of foods that they might eat, eating non-food items, pica. And then last, purposeful vomiting or rumination, just chewing on that food for hours and hours, or bringing food up purposefully when they want to communicate that something or another. It could be that I no longer want to engage with you, simple as that. So these are some challenging behaviors that might be exhibited by children with ASD. I want you to go back and think about the examples that I gave you for each of the domains and how those domains might be impacted, how it overlaps with children with these types of behaviors, and how these types of behaviors over time might impact development in each of those domains. A little more about challenging behaviors for children with ASD. I want you to first and foremost understand that autism does not cause challenging behaviors. I will say that again. Autism does not cause challenging behaviors. However, challenging behaviors exhibited by children with ASD may occur due to a variety of reasons or scenarios. So I want you to think about, in your experience, what are some scenarios where challenging behaviors may occur for children with autism? You might see a challenging behavior when there's a violation of routines or rituals. Children with autism like to do things a certain order, a certain time, and are very specific about that occurring that way each time. Children with autism might not want to transition when you're ready to have them transition, so you will see a reaction in terms of a challenging behavior. Children with autism might desire a certain sensory input, and if they're not getting that or they're getting too much of that, you might see a challenging behavior occur. If you're similarly so, the sensory overload, they are very sensitive to what is going on in their environment, even more so sensitive than children who are typically developing. So when they're experiencing this sensory overload, you might see a challenging behavior occur, whether they're yelling or covering their ears or completely disengaging from you to give you the message that they are in this state. Children with ASD might experience frustration, whether they're not able to communicate their wants and needs, or they are no longer interested in the activity, or the activity is approaching them in a way that they find uncomfortable. You might see a challenging behavior as a result of that. And then you have the typical issues such as being tired. Children with autism sometimes have sleep issues, so they either don't have enough sleep or want more sleep than they were allowed to have. So being tired, this is where it might manifest itself in the long run, in that at school or in your care, they might exhibit challenging behaviors due to being tired. And then last, you have comorbid conditions such as epilepsy or mood disorders that oftentimes may or may not be controlled with the appropriate pharmaceuticals, and that might result in a challenging behavior or challenging behaviors. So we've covered broad-based challenging behaviors and how they might impact development in all domains. We've spoken to common and uncommon challenging behaviors that might be exhibited by children with autism. And then we're also talking about some of the scenarios or reasons why these challenging behaviors might present themselves. So now we're going to go on to what the literature says about challenging behaviors in children. So general studies across childhood tells us that challenging behaviors are a concern for this population of children, right? They tend to exhibit greater problem behaviors and greater social skills deficits than their typically developing peers. By definition, right? So social skill deficits might create problem behaviors. So I do not know how to enter or exit play, or I have difficulty entering exiting play. Therefore, my solution for doing so might manifest itself as a challenging behavior. The proverbial grabbing my ball and running, that kind of thing. Children with ASD display a much higher rate of aggression towards caregivers than the general population of children with intellectual disabilities. We have inclinations to believe that that might be around communication or just immediate need to stop certain things like sensory input. And then we know that sometimes it might be maybe it's due to immaturity. High levels of aggression and challenging behavior at younger ages may suggest that learning growth, with some learning and growth, these behaviors might improve. But again, if we're looking at challenging behaviors over time for students with autism, we're looking at behaviors that are beyond what's expected developmentally, beyond that range of what we consider to be typical, beyond that. So let's talk about behavior as a tool for communication, because I mentioned that several times to this point about how behavior might serve as a tool for communication. What does the literature say? We know that challenging behaviors can serve multiple functions. Communication is one of them, but a lot of times communication is primary because children with ASD, remember back to the 5 criterion, difficulty communicating and relating to others. Challenging behavior can be replaced with behavior that communicative behavior that serves the same function. Remember when I talked about behavior, all behaviors serve a function. If the behavior that you're seeing is not desirable, then you have to think about replacing that behavior with a more pro-social behavior or less challenging behavior, because the function is going to remain, or the need is going to remain for that behavior. So the solution is to try to think about how to replace it. We do know that children with ASD are have less effective adaptation or coping skills, and these are significantly associated with the severity of the type of problem behavior. So the less adept they are at coping or adapting, the more severe their challenging behaviors or problem behaviors might be. We also know that communication training can reduce the frequency of prototypical behaviors of children with autism, such as self-injurious behaviors. We want to make sure that if we identify that the behaviors that they are exhibiting may be serving some kind of communication function, then communication training might be appropriate for them. When behavior is maintained by multiple functions, it is important to identify communication strategies that will serve the purpose of those functions to effectively decrease challenging behaviors. I feel like I keep saying that we need to zero in on what the function that behavior serves so that we can then address and change. Address and change in that we're giving them replacement behaviors that serve similar function. Verbal ability is not strongly related to severity of challenging behaviors. So not because a child, oftentimes we think it's because a child is nonverbal, why we see these challenging behaviors. We see challenging behaviors in children who are also verbal. So we want to think about what other communicative purposes might the behavior be serving other than verbal behavior. Now let's talk about how we change some of these behaviors. So from the behaviorist perspective, I want you to think about why we engage in behaviors. Again, remember back to my thought about behavior, including not only problem behaviors, but also all behaviors. So think about your own positive or negative behaviors and what might those be and why do we engage in them? Well, we know that for children, let's say people, are likely to engage in behaviors that are functional. And we're less likely to engage in behaviors that are not functional. So now go back and think about your positive behaviors and what function those serve for you, and your negative behavior that are not your negative and positive behavior that are functional for you, and the behaviors that have been extinct from your repertoire because they were no longer functional. So how do we change behavior? The two broad-based concepts for changing behavior or techniques are through reinforcement and punishment. If you wish to increase a behavior, you want to think about reinforcement. Reinforcement, positive reinforcement increases the behavior by adding a desirable event when the behavior occurs. Negative reinforcement, although it says negative, it also increases behavior, but this involves removing an aversive event when the behavior occurs. If you want to decrease a behavior, you want to think about punishment, positive and negative as well. Positive punishment decreases behavior by the addition of an aversive event when the behavior occurs. Negative punishment also decreases the behavior by removing a desirable event. But here's a matrix for thinking about how each of these systems work to either increase or decrease behavior. So if you're looking at behavior that is, you want to increase behavior, you add stimulus, that system is called positive reinforcement, right? If you want to decrease behavior, but you're still adding stimuli to do that, then that's called positive punishment. Similarly so, if you are wanting to increase behavior but removing stimuli, you're looking at negative reinforcement. And if you're looking at decreasing behavior and removing stimuli, you're looking at negative punishment. So that's how these ideas are represented over here. But I want you to think about this in terms of what is the best way to approach changing challenging behavior. And the best way, in my opinion, in our opinion, our collective opinion, is that reinforcement is the most consistent way to change behavior and to build desired responses. It's not enough to take away challenging behaviors in young children. You also have to think about building desired responses, right? So while you are getting rid of a negative behavior or a challenging behavior, you want to think about building and giving the child the skills or replacement behaviors so that it's still functional for them. So how do we do that? What does the literature say? The literature says it's never too early to begin addressing concerns in children's problem behavior. Sometimes we have the tendency to think about, oh, it's going to get better, or if I leave it alone, it might go away. Well, if it serves a strong function for them and they keep doing it, then it's just going to get reinforced. And you want to think about if the behavior is developmentally expected or of a level of intensity and persistence that exceeds normal or typical development. Because again, especially when we're working with young children, a lot of the behaviors that young children with ASD might be exhibiting would also be exhibited by children without ASD. So you are looking at behaviors that exceed that range of typical or normal development. You have to look at treatment approaches that are a combination of functional communication training, as well as the change schedules of reinforcement to decrease multifunctional behaviors. So you want to give them, especially when the behavior can be attributed to as serving a level of communication. We want to make sure that we're giving them functional or replacement communication systems that are just more appropriate. And then you're looking at reinforcement, as I said in the previous slide, or a couple of slides back, being the way to promote pro-social behaviors in children rather than just focusing on getting rid of challenging behaviors. We know that without proper intervention, these behaviors continue and may get worse. So we want to think about addressing them early and often so that they don't become more problematic. It's essential to build replacement or adaptive skills. And then last, if you focus on communication and functional skills to promote greater independence, then it's critical that we teach children behaviors that are not challenging, that allow them to access and to exhibit social skills that promote greater understanding and reduce apprehension of apprehension or self-regulation skills. We know that pro-social engagement, being able to self-regulate, and reducing apprehension to engaging with others are going to be effective means of reducing or getting rid of challenging behaviors. How do we respond to challenging behaviors? So we would do that by keeping interactions to a minimum when children are going through what we might couch as a behavioral episode. We want to interrupt and redirect the child to the appropriate behavior using minimal attention, discussion, or emotion. So we have a variety of prompts, nonverbal, verbal prompts that we might use to redirect or re-engage a child without making a big deal about the actual behavior that's occurring. When the incident of challenging behavior occurs and the child engages in inappropriate behavior, that is the time to provide positive attention to the child. Otherwise, you will just be reinforcing the negative or challenging behavior. Oh, I'm glad that you're back and ready to join us. Those kinds of statements that we use quite often. If another child is hurt or injured in that process, our tendency is to go to the child who was the aggressor per se and wag our fingers at them. That is not the way to do that. We want to make sure we give our attention to the child that is hurt by attending to the victim so that the child who is the aggressor is not getting that immediate attention. I've said this very often, I'll keep saying it, we have to teach replacement behaviors when the child is not engaging in a challenging behavior, right? Not at a time when the behavior is occurring, because then you'll be violating the previous two tips that I gave you. So behavior, appropriate behavior or pro-social skills, like everything else, should be explicitly taught, not necessarily at a time. There's an opportunity for incidental teaching, but it's not always the best way when it is a challenging behavior that we're trying to address. We need to look at consequences or reinforcement for behaviors. So certainly sometimes we think we are applying a consequence that is intended to reduce or get rid of the behavior or extinguish the behavior, but in fact it doesn't do that. It serves a function for reinforcing the behavior. We talk about children who are loud or not engaging appropriately, and then we tell them move away from the activity for now. So that consequence then serves as a reinforcement for the loud or inappropriate engagement rather than teaching them ways to engage appropriately. We also look at individualized reinforcers that can be used liberally at first and fade as needed. These are basic principles in behaviorism where we heavy on the reinforcement schedule is heavy on reinforcement early, and then you fade that over time. In order to change behavior, we need to look at what is being reinforced and how often we're reinforcing it. And as they are acquiring the skills, we're spreading out that reinforcement schedule. We also want to use environmental and contextual characteristics to engage children and add more as needed. Do we have reminders? Do we have signs? Do we have nonverbal ways to communicate with children when we want to tell them that, yay, things are going well, way to go. And using those heavily in order to preempt them losing engagement and then engaging in their behaviors. So now we're at the time for instructional and environmental supports to avoid challenging behaviors in the classroom. So instructional supports, what are they? They're features of an instructional program that helps to prevent challenging behavior. They include things like explicit teaching, communication and social pragmatic instruction or social skills instruction, using modeling, that could be peer modeling, that could be role playing, using probes, cues, prompts, and praise. So how might we use these types of instructional supports? Well, we use them by engaging in a variety of teaching methodologies to explicitly teach skills across domains. We quite understand well that we need to teach academic skills. We have to also quite understand well that we need to teach social skills and appropriate behaviors and communication skills that replace challenging behaviors. So we use methodologies such as discrete trials, direct instruction, naturalistic teaching. These methodologies should be familiar to you as a teacher of children with autism, but we can also use them to teach appropriate social skills. We want to explicitly teach communication skills, such as using incidental teaching man models using direct instruction. We want to use modeling as an instructional methodology as well. First I do, then you do. Let's watch our friend do, those kinds of things. And then last, we want to make sure we're using an arsenal of probes, such as direct questioning, cues, such as verbal and nonverbal cues, prompting by going through a hierarchical level of prompting from least to most or most to least, depending on what it is that we're teaching, and then using positive praise as much as possible, right? Positive specific praise, I guess I should emphasize. Positive and specific, so you don't want to inadvertently praise the wrong activity or behavior. So positive and specific praise, please. A little more about instructional supports, using things like functional behavior assessment, systems that are designed to reward and reinforce positive behaviors, providing practice, right? Sometimes we teach, but we don't give them an opportunity to practice, even if we have to create that opportunity. And then we might also want to use a team approach for all of the things that we want to teach children. So how are these used? So FBAs, or functional behavior assessment, involves an ABC analysis. What's the antecedent? What is the behavior what is a target behavior that we're looking to change? What is occurring before that? What is occurring after that, the consequent event? That's going to help us zero in on that function of the behavior that I keep speaking to. We have to identify, one, the behavior that we're targeting, and two, what function that serves. So we're looking at what happens before and what happens after to zeroing on the function. In terms of systems that we use to reward or reinforce positive behaviors, certainly you've heard of PBIS systems, positive behavioral intervention and support systems. We'll also look at using behavior intervention plans, contracts, token economies that are based in using tangible and intangible rewards. These are all different systems that we can employ as a part of our instructional support for students to reduce or to prevent challenging behaviors. We want to give children opportunities to practice pro-social behaviors and skills, even if we have to create those situations, contrive those scenarios. Role play, we're modeling, we're practicing, we're making up, we're setting up, we're sabotaging the environment so that they are prompted to ask, to enter a social play situation or to ask to leave a social play situation. We might use a team approach in or out of the class for behavioral support. Some of us teach in environments that include a behavioral support system outside of our classroom. If that doesn't exist, we want to think about how we might create that inside of our classroom among the team members who are in that class setting. So now I'm going to move on to environmental supports. But before I do that, I want to stop and say thank you for participating in this webinar, and to remind you that in order to obtain a certificate of completion, you must fill out the form at the certificate of completion link that is indicated on the flyer that you received for this training. So in order to receive that credit, you will have to provide this code. The code is DSD 101120. I repeat, the code is D as in dog or Delta, S as in Sam, D as in Delta, 101120. That is the code that you will need to provide in order to receive a certificate of completion for attending this webinar. So now back to environmental supports. Environmental supports are features of the classroom, program, or environment that helps to prevent challenging behaviors. What are they? They include things like rules, limits, and consequences. They include very clearly articulated schedules and routines. They include engaging experiences that occur within that space. We're looking at environmental or stimulus control. Remember, we talked about our kiddos being very sensitive, either hyper or hyposensitive to stimulus. And they also include defined responsive play spaces. So how are these used? Rules should be few, they should be positively stated, and they should be consistently applied. One of the biggest detriment to a fully functioning learning environment is that the rules are not clearly articulated. There are too many of them for the child to remember or understand, and they're not positively stated. If you think about it, you want to think about rules telling children what to do rather than what not to do. Rules and limits should have clear and consistent consequences. So if you are not doing this thing, rule number 1, then this is what will happen. That allows you to, if you by clearly articulating the consequences, it allows you to be consistent. Some of our children need schedules and routines. We have schedules posted on the board or on the wall. We might have schedules in individual desks. Each child in a room might have a different schedule. Some children might need a pictorial representation of that schedule. So think about how our schedules and routines are clearly articulated to children, and how they can be reminded of them, and how you're consistently following them. These have to be taught as well, right? The rules must be taught. The schedule must be taught. The experiences in the classroom should be a balance of active and passive. Children need to be allowed time for exploration, and we have to be sensitive to the nuances of the group. If our group tends to be more active in the afternoon, then we might want to pack the afternoon with our more active type activities. But if you're thinking about balancing or alternating, that's probably the best way to go, so that all children are engaged and you're not asking children to engage in behaviors that are difficult for them at certain times of the day. We want to make sure we use things like environmental stimulus control, controlling things like lighting, noise level, music. If we use it, it's not abrasive to some students, and using nonverbal cues when needed as well. We do know that children with ASD have some difficulty with relating to some nonverbal cues. So again, you have to know your children and decide which is appropriate and when. Physical spaces should be defined and responsive to child need. Think about the size of your children. Think about how your children can move around and free flow from one part of the room to the other, looking at how they can access materials. Some of it without asking you, some of it with asking you. Some of it with what involves working with others, some of it not working with others. There needs to be a balance between all of that, and each of those spaces need to be defined and responsive for children. A little bit more about environmental supports. These are things like relationships, looking at building positive relationships among children and adults, adult to adult. Looking at attitude, teacher temperament does make a difference. And sometimes we don't think about our own temperament, our attitude, and how that might impact children and their behaviors. looking at transitions and what functions those serve, what types of warning are we giving children, how often are we asking children to transition. Those things, if done improperly, will result in challenging behavior. Looking at directions, providing clear directions and redirection when needed, using things like work systems, visual structures, using supervision, proximity, and prearranged signals. So how do we use these? Well, we model positive relationships between and among adults, families, with our families and caregivers, from peer to peer, right? So just like everything else, we're teaching them how to maintain a positive environment. How are you today? I'm very well, thank you. I'm not feeling that well. They need to hear conversations like that going on between adults to develop empathy about others' feelings, for instance. Teacher attitude sets the overall tone for the environment. Treating every morning like it's Friday morning, excited to be there, looking forward to the day and all the wonderful things that are happening. Every day should be treated like Friday morning. That's a soundbite for you. Teaching and practicing smooth transition. What cues are you using? Making sure those cues are not, which are intended to create order, don't create disorder. If it's a loud, abrasive sound, that might create disorder for some children. If it's a nice, gentle wind chime type sound, that might create order for children and give them signal. Transition, it doesn't mean it's time to transition. It means teaching them that when you hear this time or this chime, you have a few more minutes and then we have to transition. So transitions require warning. I'm going to repeat, transitions require warning. Give clear directions that are commensurate with the level of cognition of the children. Sometimes we as teachers give very complex directions and not think about the level of cognition and where our children are, whether those are 1-step, 2-step, or 3-step directions, depending on what they're able to process and then give you back. Using positive redirection or corrective action when needed. Like us, children are not perfect, and there's going to be time where you will need to correct their behaviors. So you want to make that as positive as possible. If you know that this is an activity or time where something might occur, you might also want to be proactive in your redirection. Now remember, you're going to do these 3 things and not these 3 things, right? And then go back to your 3 things that they're supposed to do. Work systems allow independence. We have our work boxes, we have our folders, we have our bookshelf where that they can go to pull their little work box, and for the next 15 minutes, this is what you're doing. The work boxes need to be set up in a way that they are truly independent. If they have to come to you to ask you how to do something in the work box or the work folder, then it's not a work box or work folder. It's just a way for them to then have to come to you again. So you want to think it through from the child's perspective, what might be needed, what prerequisite skills are needed, what they are required to do, and if they're in fact capable of doing that independently. Visual structures within the classroom, looking at, your, let's say your listening station or your listening area or your book area being well defined away from other louder spaces that doesn't allow children to do what they're supposed to do in that area. Or there's not a structure that allows them to be separate from what's going on in other places in the classroom. You also want to provide appropriate supervision using things like proximity control. If it's an area or an activity that will be problematic or might be problematic, then you want to be in close proximity of that area, even if you're working with another group or another child at the time. Your physical presence might make a difference in terms of preventing challenging behavior from occurring. You might want to use arranged verbal and nonverbal cues, right? So what are you saying beforehand? What look, hand signal, gesture might you be using to tell children it's getting a little loud, or I'm here for you, keep going, that kind of thing? Is it a thumbs up to say it's time to keep going? So now we've covered instructional and environmental supports that you can put into place. I've covered a lot of concepts that some of them may be familiar to you, some may be not familiar to you. So you want to think about what's not familiar to you and what you might want to bring up in the Q&A. The last topic I want to cover today is what's called MTSS. MTSS. Many of you have been introduced to this concept before. We think about MTSS as a system that is used to support academic skill development, behavioral development, social skills development, a variety of ways. It's often conceptualized this way as a triangle with tiers, tier 1, tier 2, tier 3. So we look at systems that support children. It's a framework for supporting the learner and all children. It can be used to target behavioral or social emotional support for all learners. These MTSS systems will come under the umbrella of what you call things like positive behavioral intervention and support. Notice that there is a data-driven system for problem solving and for continuous improvement delineated in this model that is identified by this circle that surrounds it. So you define the problem, develop a plan, implement a plan, evaluate, and that might redefine the problem, and so on and so forth. So when you're looking at what are primary prevention type systems, you're looking at data, encouraging and reinforcing the broad-based expectations for all students, looking at school-wide perhaps expectations that all students in the building, all teachers in the building, everyone is expected to comply. And we're looking at what the support is for this system, administrative buy-in, leadership team buy-in. Then you have the next group for students who might be at risk. What are some short-term interventions or social skills programs that we can employ for these children above and beyond what we're already doing for all of the children in the school year? And then yet you still have children who might not respond. So you have children who are going to require some more individualized behavioral supports. This is when you're looking at things like your functional behavioral analysis and assessment. So the practices that you're going to employ, in this case around behavior, you're looking at who is the recipient, the intensity, basically is this appropriate for all or some of the at-risk, or is it individualized? And then last, when is it that you're implementing these practices so that they're either proactive or for students who are exhibiting patterns of challenging behavior. So in closing, by the end of today or the end of this webinar, you want to look at what are the 5 diagnostic and behavioral criteria for children with ASD. And what are some examples of those, how those criteria are manifested in children. You should be able to answer the question, how is behavior or challenging behavior defined? Broadly and generally for all children or all students. And then also for how those behaviors or challenging behaviors might impact children's development across those 5 domains. How children with ASD might exhibit specific challenging behaviors that are either common or uncommon. How children with ASD might use behavior as a tool for communication. Understanding that will allow you to devise interventions that will replace those challenging behaviors. And what are some instruction environmental supports and how they can be used to avoid students with ASD exhibiting challenging behaviors. That portion of the presentation was quite dense today, speaking to a variety of techniques and models and approaches, but they're all categorized as either instructional or environmental supports that you can use proactively or reactively to address challenging behavior. And then last, I introduced you to the idea of a multi-tiered approach for supporting behavior, a very brief general introduction. This whole webinar could be about a system that you're designing, a multi-tiered system for addressing behavior, but I wanted to introduce you to the idea of a multi-tiered system so that you understand that when you are teaching in a larger environment, whether that's a school or a childcare center, what you're doing in your classroom can be and should be a part of that larger system for the entire school or center, and looking at recipients, intensity, and timing. So this would be an opportunity for Q&A, which we will schedule one later, I believe. And then last, I want to provide you my contact information. I am Dr. Sharon Darling. I'm an associate professor here at FAU. My areas of expertise are around early childhood special education. And there's my email address if you'd like to contact me. And primary and foremost, I would like to say thank you. Thank you for watching this webinar. Thank you for having interest in the topic. And thank you for utilizing, I'm thanking you proactively for utilizing the information that I spoke of today in serving children with autism and making it the world a better place for them. Thank you.